I want to bring up next Stephanie Innes and Dr. Randy Friese. Stephanie is the healthcare reporter right now for the Arizona Republic, but on January 8th, 2011, she was a journalist for the Arizona Daily Star in Tucson. She was a lead reporter covering the shooting that day, and she continued to cover the aftermath of the tragedy for the next few years. On January 8th, 10 years ago, Dr. Friese was working as a trauma surgeon as an associate professor of surgery at the University of Arizona Medical Center. He operated on several of the victims and survivors.
Thanks, Megan. Dr. Friese, tell me what you remember about January 8th, 2011.
Sure, Stephanie. I was on call the night before the shooting. So I was finishing up that morning. We turn over trauma teams, and we finish rounding on the patients we had seen the night before. So we were just finishing up, and we had the fortune, the good luck to have two trauma teams in the hospital functioning at the time of the shooting, the victims that were coming in.
How did you first start to make sense of what happened?
You know, when you're taking care of a mass casualty situation, and it's not terribly unusual for us to get, you know, a number of shooting victims at once. 10 is certainly a lot. You don't really try to make sense of it. You're just rotely doing the task, to save patients and care for patients and move them forward in the system where they need to go, the ICU, the operating room. But it was a very difficult, it was a bit of a shocking day because the number of victims, number one, and the part of town that victims were coming to was not a part of town where you normally see a mass shooting like that. And then we did find out that the Congresswoman was one of the victims, and that was a little bit of a shock to the trauma team as well.
And you've said you did run for office after this, and you said you did that as a way of doing more good for more people. Can you talk a bit about that?
Yes, well, I mean, I've always felt as a trauma surgeon, I'm taking care of one patient, one problem, one family at a time, and certainly that's meaningful and rewarding. But I, having been involved in caring for this mass casualty situation from the shooting, gun violence has always been something as a trauma surgeon I've been focused on. Taking care of young children that are shot, telling a mother that she's lost her son, telling a wife she's lost her husband. Those are very difficult conversations to have. And after the shooting, it sort of just entered my mind that maybe I could deal with this on the community level and sort of help one community at a time rather than one person or one family at a time in dealing with legislation that promotes gun safety, responsible gun ownership.
Thank you. You've also said you're able to channel your energy and your response to the shooting into your work. Tell me about that.
Well, as I mentioned, bringing those personal stories to the legislature, I think, to help people understand at the Capitol who have not had gun violence touch their lives, how earth-shattering it can be to someone whose family, my loved one was fine a minute ago, and now they're not. They're either very injured or they're actually had been murdered. So bringing those personal stories to the legislature and the people that would be voting on legislation like this is I think a unique facet to me as a legislator, to help people understand the importance of legislation like this.
And what about what's going on now? Are there parallels, do you think, between this work and what doctors treating COVID-19 today might be experiencing?
That's a great observation. Clearly, the COVID pandemic is certainly more hyper-focused, but gun violence it can be an emotional experience. Taking care of patients, victims of gun violence, can be emotional. It can be very weighty. You feel like you're not doing enough, and all those same things are happening as our frontline medical personnel are caring for the COVID patients. And I also relate that back to the legislation I'm doing and saying I'm laying the groundwork with this legislation. Myself and Daniel, as legislators, are laying the groundwork for the state. We may not see this legislation come to fruition, but someone in the future will. And I make that parallel to caring for COVID patients. You know, when you're up on the front line taking care of these patients, the many patients coming into the emergency room, getting admitted to the hospital and the ICU, you may think of things that will help us next time, make it better, make it so that we can do a better job next time. So those are the things that will be built upon. So the work they're doing now on the front lines is helping us make it better for next time. So I think those are the parallels I find.
And what do you think COVID doctors can learn from your experiences in the months and years after the shooting? What's your message to them?
I mean, it's an emotional part of our job. A lot of times as providers, we get through the emotional part by compartmentalizing and not dealing with it in the moment. So I think that we need to learn, we should deal with this emotion when it's an appropriate time, you know, with your family, with your health caregivers, and don't continue to put it aside. Do look at it, do examine it, and do work through it. And again, the same parallels with gun violence and someone being murdered by gun violence. You can't continue to put that aside. You have to work through it.
Thank you so much, Dr. Friese.